As we journey through our later years, our bodies communicate in subtle ways. Sometimes these whispers are easy to dismiss as just another part of getting older. A little more fatigue, a bit more thirst, a cut that seems to take its time healing. However, doctors wish more seniors and their loved ones knew that these quiet signals can be early warnings for diabetes. This condition often arrives without a grand announcement, especially in older adults. Recognizing subtle signs is not about alarm. It is about empowerment and early care. When blood sugar stays high, it can quietly damage vital systems: the heart, kidneys, eyes, and nerves. The good news: this damage is not inevitable when we notice and act early. One classic but overlooked sign of high blood sugar is persistent, unusual thirst. You might feel your mouth is dry no matter how much you drink. Excess glucose forces your kidneys to work overtime, pulling water out with the sugar. That leads to more frequent urination, day and night. Nighttime trips disrupt sleep and can raise the risk of falls. The cycle of thirst and urination can feel endless and frustrating. The key is change from your normal pattern. More thirst and more trips over days to weeks. If both increase and persist, it is time to speak with your healthcare provider. Simple notes on how much you drink and how often you go can be powerful early evidence. Feeling tired is common, but the fatigue of undiagnosed diabetes is different. It is deep and persistent, not improved by a good night's sleep. Favorite hobbies, visits, even small chores start to feel like a significant effort. Cells rely on glucose for fuel. Without insulin working properly, fuel cannot enter. Your blood has sugar, but your cells are left without energy, leaving your body running on empty. Stamina drops, walks shorten, interests fade, loved ones may notice withdrawal and reduced energy. Ask, is this new or worsening? Is it paired with thirst or frequent urination? If rest does not restore you, talk to your doctor. A simple blood test can give answers. Our skin often mirrors internal health, especially with diabetes. Cuts and sores may linger and heal slowly. Redness, swelling, and infection become more common. High glucose weakens immune function and damages circulation, narrowing and hardening vessels. Reduced blood flow, especially to hands and feet, slows healing. Recurring infections, including UTIs, yeast, or boils, can be warning signs. Make skin checks a routine. Look for new cuts, sores, or red areas, especially on the feet. Do not rely on creams alone if wounds do not heal. See a doctor promptly to investigate diabetes. Some vision changes are age-related, but certain shifts can signal diabetes. Blurry vision, reading TV, recognizing faces may fluctuate day to day. High blood sugar pulls fluid from the eye's lens, changing focus and causing blur. Tell your eye doctor about changing vision. It may be systemic, not just a new prescription. Untreated high sugars can damage the retina. Early control helps protect sight. Nerves can also be affected. Tingling, numbness, burning, or sharp pains. Prolonged high sugar interferes with nerve signals. Peripheral neuropathy. Loss of sensation is dangerous. You may not feel small injuries that can worsen. Daily foot checks and reporting new numbness, tingling, or pain can prevent serious complications. Significant unintentional weight change can be a red flag. Some lose weight despite normal eating, as the body breaks down fat and muscle for fuel. Others gain weight, especially abdominal, driven by insulin resistance. High insulin promotes fat storage, and extra weight worsens resistance, a tough cycle. Fluctuating sugars affect mood, irritability, low mood, anxiety, and brain fog. Trouble concentrating or feeling confused can accompany other signs like thirst and fatigue. Together, these clues strengthen the case to check for diabetes. Keeping mind and mood steady is a powerful reason to manage blood sugar effectively. To understand the quiet signs, picture what happens inside your body. Carbohydrates break down into glucose, entering the bloodstream for energy. Insulin is the key that lets glucose into your cells. In type 2 diabetes, cells resist insulin, or the pancreas cannot keep up. Glucose gets stuck in the blood, hyperglycemia, the root of early symptoms. Your body tries to flush sugar via the kidneys, causing frequent urination and thirst. Cells starve for fuel, driving deep fatigue and sometimes hunger. Over time, high sugar harms vessels large and small, slowing healing and damaging organs. That is why these quiet signs are connected, and why early action matters. Start at home. Observe gently and write simple notes for a week or two. Track thirst, bathroom trips, and new fatigue. Look at your feet daily for cuts, blisters, or sores that do not heal. Specific notes make your visit more productive. You can say, "I'm concerned about new symptoms. Could we check for diabetes?" Common tests include fasting glucose and A1C, which shows your average over 2 to 3 months. Based on results, you may get guidance on lifestyle changes, medication, and referrals. A diagnosis can feel overwhelming, but it is a starting point, not a verdict. With care, support, and a few adjustments, diabetes can be managed effectively. Your tools are better than ever, and you have a capable team. You are not alone. Your healthcare team, your family, and your community are here. Start small and achievable. Swap sugary drinks for water, add a serving of green vegetables. A 5-minute walk after meals helps your body use blood sugar better. Take any medication as directed and discuss side effects openly with your doctor. A registered dietitian can tailor a plan to your preferences. Keeping sugars in range protects your heart, kidneys, eyes, and nerves. Consistency matters. Progress, not perfection. Lean on your support system and let others help. Notice quiet signs, seek care early, and take steady steps day by day. Choose vitality and well-being for the years ahead.